Okay, today is my first film critique. I will be presenting a X-ray finger 2 views on the left side. The date of the exam was 6/8/20. The reason for the exam was the left ring finger had an injury. The positions performed was a PA hand, it's a site protocol, oblique 4th digit, the lateral 4th digit. The patient was a male, 20 years old. He was ambulatory. The physician's findings, all views show fracture of the terminal top of the 4th finger with surrounding callus formation, soft tissue swelling seen, second fracture seen at the base of the distal phalanx of the 4th finger. He said the 4th finger. Fracture extends to joint surface. Subacute fractures, subacute fracture. The fracture fragment are in good alignment. It is deemed as a healing fracture, and I took that as nothing is going to be done, no surgery, maybe a splint or a soft cast, and it will heal on its own. So the image receptor used was a digital image receptor, a 16x16, no grid, AEC used. Technique was 62 at 1:2 mass, 40-inch SID. The brightness, I believe the views have adequate brightness to show detail, soft tissue margins. No motion is shown, sharp trabecular details on the compact and the spongy bone to reveal that. All 3 exposures are of diagnostic quality. The patient was able to walk into the department and was seated in a chair at the end of the X-ray table. The IR was placed tabletop. So this is, I'll get close now. This is the PA hand, the projection of the PA hand. Try not to wobble. Was placed pronated in the middle of the IR. The CR was centered to the MCP. The MCP and collimated on all 4 sides. The patient extended the fingers and slightly separated them. Palm was down. Patient was in pain but was able to maneuver the position. The position of the hand is accurate in its orientation. Okay, let's go to the oblique. Go focus. For the oblique, the hand was rolled up to 45 degree, or it's supposed to be 45 degrees from the IR in a lateral orientation, or laterally. The CR was centered to the proximal interphalangeal joint space, the PIP. I believe that the rotation was a little under. I probably could have rotated more. Just this is kind of open. It looks a little too PA. And I think the collimation could have been reduced because I have the carpals. I think it could have been maybe right there. I don't need all the carpals. And I believe the centering was probably a little, because PIP, I think it was a little off. It was a little high. Okay, let's go to the lateral. The patient rotated his hand lateral into a true lateral. The digits 2 and 3 were pulled out of the way by the first digit. 2 and 3 in the first digit, he's pulling them. and then the 5th digit was extended out to visualize 4th digit in a true lateral. The metacarpals demonstrate they're superimposed, so it is a good lateral. Okay, so let me go back to PA. Okay, so in this, it demonstrates the carpals, the metacarpals, phalanges, inner articulations of the hand, the distal radius and ulna, where was I? Sorry. Are seen. The sesamoid bone on the, I'm going to point that out, is seen on the 1st digit at the MCP, just showing that it has adequate penetration to visualize that, and the density or the brightness is good, that you can see that. The where was I? Equal distance. The oh yeah, it's a good PA because these are equal distance apart. Okay. Let's go to oblique. The entire digit is seen along with the accompanying digits on either side. See, this could have been a little more collimated. This is good. A little more collimated. Don't need all this. The bone detail and soft tissue structures are seen in the distal interphalangeal joint, proximal interphalangeal joint, and metacarpal phalangeal joint is seen on the 4th digit. So the dip, pip, MCP. Back to the lateral. So the dip, pip are clearly seen. The MCP, it's slightly obscured by the surrounding digits because the patient was unable to move his fingers all the way. He was in pain, so he couldn't pull these fingers farther to get the MCP better seen. The joint spaces are open though. They're very open, which is good. Good lateral. There's trabecular marking and soft tissue is seen, and the patient was shielded. He got his finger stuck in he was gonna blow the leaves off of the lawn, and he got his finger stuck in the, oh my gosh, what's it called? The fan. So it sounded awful. But that is it. Thank you. Bye.